So this is our lovely patient, and today we're going to show you how to change her dressing after a deep plane face and neck lift. So after you cleanse your incisions underneath your chin and behind your ears and apply a thin layer of Aquaphor on top, we take our telfa that's already pre-cut up into 3 pieces, and we start off by placing the telfa underneath the chin on this incision here. Generally, I have the patient help me when I'm going through the dressing because a lot of the times it's hard to just do it on your own. And this is where your significant other, whoever's home with you, will come in to help. So one of the 3 pieces of telfa will go along your incisions here and behind your ear. In order to make it so it stays, we actually have to cut it into a Y. So the top half of this Y will kind of be a line and will go in front of your ear here and behind your ear. And in doing so, we'll protect the front incisions and prevent it from being over the ear so you could actually hear. After we apply the telfa, we'll have a gauze that's cut in a similar pattern. So the Y at the top and the length down here. And this you'll flip over the ear here. And this is kind of where the second hand comes in, because you'll have to hold it here, and then after this, when we do it on the other side, we'll proceed to wrap the Kerlix gauze around. So my patient here is helping me hold the gauze on either side of her ears. From here, we're going to put a gauze underneath her chin to protect that other telfa. And then we're going to start with the Kerlix wrap. So the Kerlix wrap, we're going to start underneath the chin, hold it here, and we'll want to wrap it to replace where her hand is. The most important thing about the Kerlix wrap is to make sure that the drains still have room to come out the back and that the wrap is positioned behind your ear. Also, when you're wrapping this, you'll use the entirety of the wrap, but you want to make sure at the end that you could still fit 2 fingers inside the wrap, so that's how you know it's not too tight on your head. So after this first Kerlix is on, you take another Kerlix and you'll go around and do the same thing again. So there's 2 supports on top. And then when you're finally all the way around, you're just going to take a paper tape and you'll cut it. And then this paper tape will be used on this side just to hold it in place. This dressing is really just to protect your incisions that first week post-op and to make sure that they don't catch on anything afterwards. So when the head wrap is on, the drain will come out from the back of the dressing here. And in order to secure the drain, we need to use a safety pin and clip it to the outside of the head wrap. When it's on the outside of the head wrap, this will be sure that the drain drains properly and that it's safe from any pulls or tugs when you're just walking around in your daily life. So when it comes to unwrapping the dressing, the first thing you want to do is unclip the safety pins for the drains on either side. When you go to unwrap the dressing, it's okay to have the drains hang on your chest. And then the first thing that you do is either take scissors or rip off this paper tape here and just start by unwrapping the Kerlix. So after you take the Kerlix off, then you proceed to take the gauze and the telfa off and clean your incisions, and then repeat the process.